Dr. Wynn Hammerly with Qual Choice is back with me now with great information on staying healthy during pregnancy. Thanks for being here.
Sure.
Well, it's no secret that I'm pregnant at this point, so you know, it's really good to stop and think about your health. This time better than ever, right?
Yeah. Obviously, your pregnancy, staying healthy is better if you start healthy.
Right.
But if you're not there, then it is a great reminder to, you know, maybe make some adjustments.
Right, some lifestyle changes for sure. We know there's a couple that right away need to be made for sure, and that's smoking and drinking, right?
Right. Smoking for all the obvious reasons, but specifically in pregnancy, it decreases the blood flow, it causes growth retardation, it causes complications. And then alcohol obviously also causes developmental problems and potential deformities. So if you're thinking about pregnancy, you actually want to stop those things before you get pregnant. And as soon as you are aware you're pregnant, then by all means stop.
Absolutely.
In terms of diet, you're eating for two.
Right.
So you want to have plenty of protein and calcium for the bones, for the baby, growing baby. Whole grains, lots of fruits and veggies. Fiber is important because with all the space taken up in there, sometimes things don't move as well.
Right.
So that's important.
Yes.
Drinking plenty of fluids. The other thing interesting, you think about the weight gain during pregnancy. Well, part of it is the baby, but also your blood volume expands.
I've heard that.
Yeah. And so you need to make sure that you're drinking plenty of fluids. A good prenatal vitamin is actually a good thing to take before you get pregnant too.
Right. Good to go ahead and get on that.
Yeah.
And you don't have to really start that routine then once you do become pregnant.
Right. Staying physically active is important. You know, during pregnancy often you tend to get backaches and some bloating and swelling, and staying active really helps with that. What they recommend is 30 minutes 5 times a week, so 2.5 hours a week. Something where you're a good brisk walking or even more vigorous. They generally say don't get your heart rate up too high, but you want to, you know, break a sweat.
Right.
So.
But you don't want to be completely overwhelmed or get your heart rate way too high for sure. Yeah. Now, what would you say, I know that there's a lot of people that go through sickness during a certain period of time. They don't want to work out. You know, maybe there's a couple things they don't want to eat. Just kind of, do they just need to just navigate and push through that until they can get to that point?
Well, you know, in terms of nausea, there are a variety of things. You can use ginger tea, you can use things that you know, if there's things that are less appealing during that time, that's okay. And then as you get past it, then you'll
incorporate those things in later.
You know, the strange kind of cravings, that's okay. That's okay, as long as you're not eating ice cream and pickles through the whole pregnancy.
Just that whole time. That's all you're eating, right? You don't want that to happen.
Right. But occasionally, if you get a craving, that's fine.
That's okay, yes. Well, let's talk a little bit about health, too, because I know that's very, very important.
Sure. Now, what you're going to want to do is get in fairly early in the pregnancy so we can do screening tests, look at ultrasounds, make sure the baby's developing normally. Actually doing genetic tests, screening for abnormalities. So the more information you have, the better informed you are, the better decisions you can make. There are interventions that can be done if you identify a problem at an early stage. We're going to monitor blood pressure. Blood pressure actually goes down. It kind of reaches a nadir or a low point somewhere around maybe 18, 20 weeks. And then it starts to go up a little bit, but it's supposed to actually be lower because, again, your expanded volume and dilated blood vessels and so on really actually lower it. Actually having an aspirin a day is actually a good thing to prevent preeclampsia, which is a complication with elevated blood pressure and the kidneys not working as well. So in addition to your prenatal vitamin, they actually recommend taking a baby aspirin.
Very interesting.
To prevent complications.
Did not know that one as well. And then, of course, as we wrap up here, it's important to be updated on vaccines and make sure you're not getting sick, right?
Right. We're going to check your blood sugar. There is a tendency for blood sugar to go up some if you're kind of borderline. Your pancreas is now working for 2 of you.
Right.
And so, again, staying physically active, having a good diet is going to decrease the chances of that being an issue.
All right.
And the immunizations actually provide passive immunity for your baby after birth.
Well, all very good information, and thank you so much for being here. I might eat one of these apples here during the commercial break. Well, to find out more about Qual Choice, go to their website. It's qualchoice.com, and you can also give them a call. They always have lots of good information for you.